I'm Kate Chaplinsky for the HAN Network. September is National Pain Awareness Month, and we're at Silver Hill Hospital in New Canaan today to talk about chronic pain and the use and misuse of opiates. And I'm joined in that conversation by Dr. Seddon Savage of the Chronic Pain and Recovery Center here at Silver Hill. Dr. Savage, happy to talk with you.
It's a pleasure to talk with you as well. Thank you.
Well, Dr. Savage, let's get right into it. What are some of the opiates and opioids that are prescribed in cases of chronic pain?
Well, first of all, opioids are very powerful pain medications. They've been used for literally millennia. The first recorded use of opioids was back 3,000 years ago, and ironically, it was called the joy plant at that time. Since then, it's been a rocky road, as you know. Opioids are very powerful medications. They're powerful in healing when used well, but they can be very powerful in causing harm when misused or misprescribed. So some of the common ones with the original opioids were derived from the opium poppy and are still used today. And the naturally occurring opioids from the opium poppy are morphine and codeine. So very familiar names of medications for all of us. Then there are semi-synthetic opioids, which are derived from chemical variations of morphine, such medications as oxycodone, which you may know as Percocet, hydrocodone, often marketed as Vicodin, hydromorphone, maybe better known as Dilaudid, and those are semi-synthetic opioids. Then there are a number of wholly synthetic opioids, and those are such things as methadone, buprenorphine, fentanyl, and those are classified as opioids because they bind to the same receptors and they cause potent pain relief. There's some other therapeutic uses of opioids as well. Sometimes they're used for cough, and sometimes they're used for diarrhea as well. They have been over the centuries, though we have newer medications for those treatments. But for pain, opioids remain the most potent medications we have.
And let's talk a little bit about chronic pain and how are opioids used in the treatment of someone with chronic pain?
Opioids are used really aggressively for the treatment of acute pain, such as that following surgery or if somebody has a motor vehicle accident and many fractures. They're also used aggressively for treatment of pain at the end of life. Their use in the treatment of chronic pain, that is chronic musculoskeletal pain or chronic pain that persists many months after surgery, or pain due to chronic medical illnesses, is somewhat more controversial. It's clear that there are some patients who do well over a long period of time using low to moderate doses of opioids, but many patients don't do well over time. Opioids, when they're used on a long-term basis, opioids have some properties that can be problematic when used long time. In some patients, there may develop tolerance to their effects so that you need higher and higher doses, and often people will get greater side effects on higher doses. We also know that higher doses across the population are linked with higher rates of adverse consequences such as overdose, and also the development of increasing pain. That sounds contradictory, I know, because they're such great pain relieving medications, but they are known to create something called hyperalgesia or hypersensitivity to normal stimuli that then become very painful. So over the long term, for many patients, opioids can be problematic. And here in our program at Silver Hill, we find that some patients do quite well. In fact, will have less pain or no more pain, but a higher level of function when we taper them down and often off of opioids. That said, there are a subset of people who do very well long term. So it's controversial. You read lots of different things. We aim to find balance in the use of opioids long term, but we find most patients do well with other approaches to pain treatment. I think you'll hear about some of those from my colleagues.
Now, Dr. Savage, what is the link to addiction? You hear a lot about opioids and addiction. How does that occur?
So, like all substances to which people can become addicted, whether we're talking about alcohol or cocaine, marijuana, opioids, opioids produce reward or euphoria in a very ancient part of the brain. It's called the limbic reward system. And that center in our brain is very, very important to survival. If you think about pleasures in life, food, drinking water when you're really thirsty, sexual activity, it's very important for the survival either of the individual or the survival of families and communities and the species. This is a powerful part of the brain. It's necessary to survival. And these drugs which produce addiction stimulate reward. Now, many people will have a glass of wine or might use illicit substances now and then. Not recommending it, but they might, and find that they enjoy it, and then they stop if they have to get home to their families, or they have an exam to study for, or need to get to work. They don't continue to use alcohol or other substances to excess. But in some people, that reward may trigger changes, neurobiologic changes in the brain that create almost a drive state, a craving, a need for that substance. It feels like it's necessary to survival. So it's a very powerful kind of calling. And over time, that limbic reward center recruits other centers in the brain, the centers that drive motivation. Normally we want to support our families, we want to put food on the table, we want to enjoy our time with other people, but the drug becomes more important than all those things that we would normally enjoy. And so memory and learning centers, motivational centers, start serving that limbic reward center. And it's very challenging to treat. It's treatable. Addiction is treatable, and we have good outcomes with appropriate treatment. But opioids seem to be particularly prone to inducing that kind of addictive attachment more than things such as alcohol, for which certainly for some people that's a huge problem, but more people who use opioids for the purpose of reward, not necessarily for pain, but for the purpose of reward, when they start misusing them to get high, a greater proportion of those people will develop challenges with addiction than persons who use alcohol, say, on an occasional basis to experience reward.
Now, Dr. Savage, you mentioned earlier the risk of overdose and the concern about that is related to opioids. Can we talk a little bit more about that and how that could occur?
Yes. As we mentioned before, opioids can be powerful for healing when used well, but they have harms associated with them. We've talked about addiction. Another one of the harms that they can cause is overdose, unfortunately. And opioids do that by suppressing the brain's drive to breathe. As levels of carbon dioxide rise in the body, normally if you hold your breath or you stop breathing, carbon dioxide rises and signals the brain that you need to take a breath to get oxygen into your body, to get rid of excess carbon dioxide. But opioids suppress the brain's responsiveness to carbon dioxide, and people slow their breathing down. And if they have too much opioid on board, they can actually stop breathing. If you stop breathing, there's less oxygen to your heart, and eventually your heart stops beating. So that's how opioid overdose occurs. Now, we do have a remedy for that if somebody catches somebody whose breathing is very, very slow and they're not arousable. Using an opioid antagonist, the most common one is naloxone. Commercial name is Narcan, and you've probably heard about real efforts to get Narcan out into fire stations, EMTs to use it, people who use opioids to have Narcan in their home. So if somebody's slowing their breathing or they've stopped breathing but their heart's still going, you can reverse that opioid effect. It blocks the opioids effect, and somebody will wake right up and begin breathing again. Some people are more at risk for overdose than others. Certainly we know that persons with a history of substance use disorders may be more inclined to overuse their opioid and be more at risk for overdose. There's certain medical illnesses as well, particularly respiratory illnesses such as sleep apnea or COPD, which in combination with opioids may put people more at risk for respiratory arrest.
Now, let's talk a little bit about someone you care about, someone you love. What do you do if you suspect that they might be experiencing some issues with opioids and addiction?
Well, first of all, it's important to recognize when there are problems. When we use opioids, we expect somebody to feel better, and if they're feeling better, to become more active and more engaged with things that are important in their lives. So if somebody's prescribed opioids, but they're complaining more, or they're sedated a lot of the time, they seem less engaged, less interactive, not going out, I'd be concerned that something is really wrong, and they may be developing a problem with the opioids. There may be other explanations as well, but it's worth bringing up with them and with their healthcare providers. Treatment is available. Finding a drug and alcohol counselor can be helpful. More and more people in the recovery community are getting involved with helping people who seem to have active addictions or problematic relationships to substances, including opioids. I don't know if you've heard about recovery coaches, but many people in recovery are now getting trained. And if we have we estimate that over the course of a lifetime, about 10% of people have a risk of developing addiction. So as we train more people to be helpful and intervene with other people in society who are having problems, that may be a very powerful source of support for families and communities. But finding a licensed drug and alcohol counselor, talking to your primary care physician or the individual's primary care physician is also very important, because clinical healthcare providers can't help if they don't know that there's a problem.
Now, what do you suggest? Because a lot of people do have in their medicine cabinet maybe some opioids. How should they secure those? What's the right process?
Okay, so that's very important. We know that about 70% of people who non-medically use opioids, and that's using it for a purpose other than intended or using somebody else's opioids, a prescription that wasn't given to you, about 70% of people get their opioids from family and friends. And so sometimes they're shared or given to somebody, but very often they're simply taken from a medicine cabinet or from the soccer underwear drawer, which is the most common place that people hide their opioids. So just hiding them, thinking you've found a good place, is not enough. We really recommend that people get a medication safe. They're available at many pharmacies, and lock your medications when they're not actively in use. You can't be sure who may be diverting opioids. Young people, children, teenagers may divert out of curiosity and not know how dangerous these medications can be. So education is important too if you have them in the home. But the other thing that I'd recommend, I think locking the medications is important, not letting too many people know that you have them. It's really nobody's business. Your spouse you may want to know, some care provider, your healthcare providers, but not broadcasting that you're using these medications, locking them, and being aware that almost anyone can divert, either out of curiosity, out of addiction, or other things.
Well, Dr. Savage, thank you so much for talking with us today. It's very informative, and thank you for all the great work you do here.
Well, thank you so much for your interest. These are really important issues, I think, and I appreciate your covering them.
Thank you. All right, you can find out more about our partnership with Silver Hill Hospital at han.network.